Hey, it's Dr. Anderson at Life Centers Chiropractic in Missouri City. Today I'm going to talk to you about some helpful tips with sleep position. So sleep position is actually pretty important to keep stress off your spine, especially if you're already having challenges with your neck, you're getting numbness in your arms and hands every time you go to sleep, you're having problems with hip pain, lateral hip pain as you're laying, or lower back pain and it's hard to get comfortable. So there's a few things to consider here. So I want to look at the normal anatomy inside of the spine and the pelvis. So when you think just sensically about this, the first thing, if you look at the foundation, there's 3 separate pelvic bones. They should be in a orientation. You don't want to be tilted or rotated overly, in one position or the other. And then the spinal column normally should be straight up and down. That's normal symmetrical alignment. When you look sideways, sometimes this surprises people. You're actually supposed to have an arch. So there should be an arch in the neck, reverse arch in the mid-back, and an arch in the lower lumbar. And this is like a spring for shock absorption with movement and to resist gravity. It creates strength and lever arms for muscle connection and cushioning. So that's really important. So a couple things that are tips. One, if you're having a lot of pain on the lateral side of your hip as you go to bed at night, or you're having trouble with your legs going to sleep with sciatica pain or numbness or tingling, or you have issues with your lower back and it's hard to find a position, one thing to consider is you can be on your side if it's neutral, but a couple tips on your side if you're a side sleeper. You don't want to be all twisted in rotation on your side. So you don't want to be sleeping with your pelvis all twisted and your lumbar spine all twisted against your torso going the opposite direction all night long. One tip there, if you're getting too twisted or you're getting pressure or your legs are hurting or going numb, try putting a pillow in between your knees in this orientation when you're on your side, and that will create kind of balance, take some of the pressure and the weight of the leg. The legs can be actually pretty heavy and as a percentage of the overall body weight. So that can help support the weight of the legs, make sure it's not pulling down on the pelvis unevenly or creating unnecessary torsion in the pelvis of the lower lumbar or the discs. So that's one thing that's helpful. Another thing on your side is you want to consider, pillow position. It's okay to be on your side, but you should be supported if you're on your side. You don't want to be propped up like this with a kink in your neck, violating that alignment here where you're like this on your side. Or similarly, if you're laying down and you don't have enough of a support of the pillow, or if you're very broad-shouldered, some of the bigger men that have broad shoulders, they need more support between the mattress and their head to make sure that they're not sagging, similarly in that position, creating stress on the lower nerves in the neck that go to the arms and hands, and they keep going to sleep. And you go one side and it goes to sleep, and you wake up and shake it out, and you go the other side and it goes to sleep, and you're waking up and shaking it out. That might be something to consider. Another thing to consider is when you're on the side position is, you don't want to be curled up in a ball. You want to protect this really important curve of the neck. There's nerve roots in there, the spinal cord's in there. The disc, if you already have cervical disc problems, that can be problematic in a tucked position, putting pressure on those discs that are already injured or swollen. And then the last thing, obviously, that we want to avoid is the stomach sleeper, right? So if you're on your stomach, it's kind of common sense that you don't want to be like this all night long, or even worse, like this all night long, and now you have the combination of all of it at once. You have the pelvis rotated, one leg up, pressure on the hip, torsion in the lumbar, torsion in the nerves, head cranked to the side. Obviously, that's a recipe for waking up in a lot of kinked up positions in your neck, in your shoulders, your lower back, even your pelvis. So just think about symmetry and alignment, think about support for the natural alignment and curves, and I hope that helps.